Hey everyone, and welcome to This Explainer. Today, we're pulling back the curtain on the high-stakes world of medical billing compliance. Tens of billions of dollars are lost to healthcare fraud every single year, so getting this stuff right is absolutely critical. We're going to trace the rules of the game, all the way from those macro-level federal agencies right down to the micro-level, the actual desk of a medical biller or coder. So let's dive right in. If you work in healthcare administration or you're studying to get there, this is foundational knowledge you absolutely need to have. So you might be wondering what actually happens when a medical biller breaks the rules. Well, the stakes are incredibly high, and it exists on a sort of spectrum. First up, you have waste, which is basically just careless or inefficient billing practices. Then you have abuse, which is an accidental overutilization that results in improper reimbursement. And finally, there's outright fraud, which is the knowing and willful misrepresentation of services. We aren't just talking about a minor administrative headache here. Even a simple billing error, if it's handled incorrectly or done willfully, can spiral into a massive legal issue, resulting in devastating fraud accusations and severe financial penalties.
All right, here's our roadmap for today. We're covering 5 key areas: meet the rule makers, HIPAA and patient privacy, compliance do's and don'ts, avoiding fraud and abuse, and handling overpayments correctly.
Section 1. Meet the rule makers, the referees of the healthcare system. It's honestly fascinating how these massive entities interact. You've got the Department of Health and Human Services, or HHS, sitting at the top as the overarching body in charge of preserving Americans' health. Underneath that umbrella, we have CMS, the Centers for Medicare and Medicaid Services. Now, CMS administers programs for millions of people, particularly the elderly and disadvantaged. Because public money is being used here, CMS sets incredibly strict standards for coverage and reimbursement. And here is the really crucial point. Commercial insurance payers very often just copy Medicare's criteria regarding medical necessity and payment restrictions. So when CMS makes a rule, the whole industry usually falls right in line. And that brings us to our next agency, the OIG, or the Office of Inspector General. Established back in 1976, this is actually the biggest inspector general office in the entire federal government. Think of them as the primary watchdog. They focus on finding waste, fraud, and abuse through their annual OIG work plan, which targets high-risk billing areas. And when facilities fail to comply, well, the OIG enforces strict corporate integrity agreements, or CIAs, to force them back in line. They're the enforcers ensuring compliance programs actually mean something out in the real world.
Moving on to Section 2, HIPAA and patient privacy, the national standard.
If we look back to before 1996, there was a stark contrast in how we handled data. The privacy of health information was controlled by a total patchwork of specific state laws. It was just wildly inconsistent from state to state. But in 1996, Congress passed the Health Insurance Portability and Accountability Act, HIPAA. This revolutionized data protection by establishing strict federal guidelines for health plans, clearinghouses, and healthcare providers. It basically created a unified, nationwide standard for safeguarding patient rights. So what exactly are we protecting? It's PHI, personal health information. The core principle of HIPAA compliance is incredibly straightforward. If someone doesn't absolutely need the information to do their job, they shouldn't see it, period. Patients in a waiting room don't need to know the name, date of birth, or diagnosis of the person sitting next to them. It is all based entirely on a strict need-to-know basis.
Section 3, compliance do's and don'ts, the cubicle level.
As a medical professional, you have a crucial part to play here. Let's look at the daily do's. Use obscure passwords. And no, the word password doesn't count. Change them frequently. When you're discussing patient finances, whether it's in person or on the phone, always keep your voice low. And interestingly enough, if you work in a surgical center, wear the proper uniform so patients don't feel uneasy seeing a stranger in casual attire. These simple daily habits tie directly into the OIG's 7 core elements of an effective compliance program, which include things like mandatory staff training, having written policies, and designating compliance leadership. Now let's talk about the don'ts. Do not write your passwords on a sticky note on the side of your computer. Do not share them with other staff members. Never use 1, 2, 3, 4, 5, and please don't discuss personal matters in front of patients. Avoiding these behaviors requires the other OIG pillars, things like open reporting channels, routine internal auditing, fair enforcement, and prompt corrective action when these rules are inevitably broken. In today's digital age, confidential patient information can so easily fall into the wrong hands without these strict levels of protection. Section 4. Avoiding fraud and abuse, the high stakes of medical billing. Understanding the difference between inpatient and outpatient status is absolutely critical. An inpatient is formally admitted to the hospital by a physician's directive, but an outpatient, that's someone being treated or even held overnight who hasn't been formally admitted. Just because a patient spends the night in a hospital bed does not make them an inpatient. This distinction perfectly highlights that spectrum we mentioned earlier. Accidental overutilization, like mistakenly billing an outpatient overnight stay as an inpatient, is considered abuse or waste. But a knowing, deliberate misrepresentation of that status just to get a higher payout, that triggers devastating fraud accusations and potential criminal prosecution. Then we have the constant battle of undercoding versus overcoding. Undercoding is failing to identify billable codes. It's known as leaving money on the table. And yeah, you can get fired for it because it actively hurts your employer's bottom line. But overcoding, that plunges the provider straight into the realm of fraud and abuse. Overcoding includes willfully providing inaccurate information or claiming services that were never actually provided to the patient. This is also exactly where major federal laws come into play, like the anti-kickback statute, which prevents kickbacks for referrals, and the Stark Law, which stops physicians from referring patients to services they financially benefit from.
And look, the consequences here are definitely not just a slap on the wrist. The False Claims Act literally criminalizes scamming government programs. Submitting a fake claim or establishing a fraudulent record is illegal. If information is disclosed with the intent to profit financially or maliciously, the penalties are incredibly severe. We are talking up to 10 years in prison and a massive fine. The government simply does not play around with taxpayer money. This act also includes qui tam provisions, which basically means whistleblowers who report this fraud can actually receive a percentage of the recovered funds.
A huge part of avoiding fraud is understanding bundling. The NCCI, that's the National Correct Coding Initiative, mandates that certain procedures have to be grouped together. Unbundling is when you separate procedures that the NCCI says should be billed together, often as a sneaky attempt to get a higher reimbursement. If you try to bypass NCCI edits without the proper justified modifiers, you are on a fast track to failing an audit and facing serious compliance violations. And this is exactly why routine internal audits like chart sampling and error rate monitoring are designed specifically to catch this exact kind of unbundling before it turns into a massive liability.
Which brings us to our final section, Section 5. Handling overpayments correctly. Returning the money. Look, if your office gets paid too much, you can't just quietly keep the money. Here are the exact steps you have to follow. Step 1. Identify the erroneously coded or invoiced claim. Step 2. You must follow the mandatory 60-day self-disclosure protocol to notify the payer immediately. Step 3. Complete a voluntary refund form. Completing this voluntary refund within that 60-day window is exactly how a provider mitigates severe False Claims Act liability and prevents future fraud accusations.
But simply returning the money isn't always the end of the process. If a claim didn't process successfully because of coding errors, you often have to file a corrected claim. Payers usually require specific paperwork for this, typically asking for the original claim number along with the justification field to explain exactly what is being fixed. It requires absolute meticulousness to ensure the record is set straight. So are you ready to be the first line of defense? Medical billers and coders aren't just doing data entry. They hold an immense responsibility. You're protecting patient privacy, you're safeguarding your employer's revenue, and honestly, you are the shield standing between your practice and devastating federal indictments. Please like, share, and subscribe to Decode Healthcare with Harshal.